Hey, this is Dr. Carolyn Harmon of Stridely Life Coaching. Welcome to my channel, and make sure that you click the like button to let YouTube know that you like my videos. Click the subscribe so you can get all the new updates as they come. And of course, leave a comment to let me know how you really feel about my work. All right? In this clip, I interviewed Dr. Melissa Sinelli. She's going to tell us all about chiropractic care for chronic illnesses. So let's get to this interview. This is part 2 of my interview with Dr. Melissa Sinelli. Hope you enjoy it. From the functional medicine perspective, if we can take care of those insulin spikes, having too much insulin in our blood, then we lower the risk of not only diabetes, but heart disease as well. And probably a bunch of other conditions. A lot of chronic conditions are all from the same source. So from the time that we start seeing a rise in our insulin so that we're getting resistant to the time that we actually start seeing like the medical tests going awry or getting a little bit out of order, is that like months or years or weeks or?
Well, so with diabetes, if somebody has high blood sugar, like you're talking about, where now they're in a diabetes situation or even pre-diabetes, say they have pre-diabetes, but they don't really do anything to modify their life or change to reverse it.
They keep the same diet, the same exercise routine, the same lifestyle. And
it doesn't reverse. And now it becomes diabetes. That can happen, within several months. It doesn't even. But for the longer term problems such as kidney disease and peripheral neuropathy, that can take some years, a couple of years. Okay. So what we do in functional medicine is a monofilament test, and it's wonderful. So it's just this basically skinniest little thing you can imagine, like a probe, but it's so thin. And we're looking at the back of someone's foot.
The capillary?
Not so much on the capillary, but just on the skin. It's almost like it's like a sensory test for the nerve. So we're taking the monofilament and we're just pressing it lightly on the back of the foot, the top of the foot, sorry.
Right, near the toes, the flat part, yeah.
Yeah, on top of the toes, on top of the foot, in 4 different points. And we're holding it, we have them, their eyes are closed, we're holding it for a minute, and we're asking them to tell us when they feel it.
Okay.
And so they this is very predictable for if someone's going to have diabetic neuropathy. So they need to have at least, so there's 4 points on each foot, so it's 8 points. They have to be able to identify 5 of those.
5 edited, okay.
Right. So if it's not the sensitivity. It's a predictive value of 87%, positive predictive value, 87%. Sensitivity is 72%. Specificity is 64%. So it's sensitive at determining if someone is heading towards peripheral neuropathy.
Okay.
That's what we don't want. We don't want peripheral neuropathy. We don't want retinopathy. We don't want kidney disease. These things are harder to reverse, not impossible. We always keep the hope, and we have tools to reverse these things. But I'd much rather reverse pre-diabetes and even the beginning of diabetes than try to undo that kind of nervous.
The more organs involved, the harder it is to undo.
Yeah, yes, absolutely.
Yeah. And so the best way is to really monitor, know about what these illnesses are, or how to regulate your diet so that you don't get into those situations. Yeah. Once you're in those situations, it's time to start. Yeah. Because it may not. I guess with functional medicine and traditional medicine together, you could better manage it. And who knows how. It's probably a very individual thing for how long it would take for you to fully reverse it if you could. And some cases, I assume you can, and and some can't. It's just, but.
Right. In some instances, the person at least is able to go down to the lowest possible dose of their metformin or whatever they're taking to help manage it. But at least they are on the minimal dose, and they are in so much, they've been listened to, they've been seen, they've been heard, they're understood. They have a personalized food plan and lifestyle plan. They are able to manage this, and they know it's not going to get worse.
Right. Because I work with a lot of people who do come from the physician after they've just been diagnosed with diabetes or pre-diabetes, and they have a plan. And I explain to them how to really work that plan. I explain to them not necessarily the nutritional values, but how to incorporate things into their mind so that they don't fall into the trap that we've already fallen into, but how to get out of it. Like, holidays are coming and everybody's going to want to have sweet potato pie, and how they can adjust themselves so they can have a little bit, but you don't want to go overboard. And at the same time, know how to bounce back, because there's going to be times where you can do like 2 salads a day for like weeks and months and be totally satisfied. And then you're going to want something else, something different. And let them know it's okay to go a little bit, but come back to something that's more realistic or something that's more healthy. And I think a lot of people are surprised how much better they feel when they're eating right.
Yeah, and how delicious it can be.
Oh yes. They
didn't know, because they just maybe never had that exposed to them.
Because one of the things sugar does is it coats your tongue, and you don't even know. You don't know that something like, I don't know. I have this thing now for turmeric and black pepper. I mean, I just love them together, and olive oil, garlic. I just love those flavors in my mouth popping.
Oh, and the black pepper helps you absorb the turmeric.
Yes. And it's really flavorful too. I mean, it stains a lot of stuff, but it's still really flavorful, So I enjoy that. And I think those things may have been in my food before, but there was so much sugar, I just couldn't taste it.
That's it.
And other things that I've been eating. But
you just hit the nail on the head. I think the reason why there's such an epidemic of diabetes and pre-diabetes is because of all the processed foods that are hyper palatable, meaning there's so much sugar, fat, and salt in them that we wouldn't find in nature, in just a regular whole food, that they are very addictive. And it's hard to stop eating them, no matter who you are, because of the dopamine that's just like releasing from. And so
kind of like hijack your biochemistry.
I mean, it's truly easy to become addicted to certain foods. And I think health coaching is so important here, because it's, it takes time to change behaviors. And sometimes there's emotional eating going on. And if you're human, I think, been an emotional eater at some point. You've eaten out of emotion. I mean, that's absolutely a human thing, but it takes, in the beginning, I think it just takes a little bit more communication and interaction with the client to help them until they're on their way and these things become lifestyle. So I'm a big proponent of health coaching, nutrition coaching, and that kind of support.
Let me ask you a question that just came to my mind. I understand that, all right, your spine has all the nerves in the body that come from your brain. So they go to not only every organ of your body, but every single living or dead cell, because that's why that cell is able to function, because it's getting a signal from your brain. And so the cells function, so the organs function.
That's right.
So adjustments to the spine in the case of diabetes could also be very helpful, not only for or just getting getting all the cells to respond a little bit, because if you have some kind of impingement or something, they're not going to be responding. So it's not only for the neuropathy that you're trying to help or prevent or to make better, but for just the day-to-day situations or functions of your body. Wouldn't that be accurate?
Right. Yeah, that is accurate. So when your body doesn't have nerve impingement, it's functioning at its best.
Right.
And when your body can communicate to your organs and your blood vessels, all those things require healthy communication between your brain and that organ or that system. You're going to function at your best. So your metabolism is going to be better. And diabetes is a metabolic condition.
Right.
So yes, and the one of the greatest studies I've seen showing the connection between a chiropractic adjustment and something that's not, pain related is one that showed that the atlas this is the very first vertebra, when that is adjusted, when it's needing to be adjusted, and it is adjusted, it balances hypertension. It reduces high blood pressure.
Okay.
So yeah, and that I can reference that tension. Yeah, I can say I have all these references available for you if you need them, but I'm I've just flipped back the reference. But actually, I have them all if you.
Yeah, you could send me the links to the references, and then I can when this is posted, they'll be available for whoever.
Oh, that would be great.
Yeah, that'll be really helpful. I do appreciate that.
Okay,
that'll be really good. Because chiropractic, it's always been of an interest to me, because it just seems like it does make a lot of sense of structure and function. I mean, that's why airplanes fly, why cars. So it makes sense. It's why people move. Very related to kinesiology, but totally not the same thing. But they're all of them go together to complete us. So for a functional medicine and chiropractic combination, it sounds perfect. It sounds like you're getting the structure and you're getting the function of the metabolism, or I don't know how to say that word, but you know what I mean. Yeah, metabolism.
Yeah, I was drawn to functional medicine because the philosophy is the same as chiropractic. Let's get to the root cause and let's correct it. Let's balance what's imbalanced and help the body do what it's designed to do, which is heal and function. I love it.
Right. So a typical patient that comes to you, do they come to you with diabetes? Say, look, or they're already coming to you for weekly adjustments, monthly adjustments, or however, and they find out along the way?
There's two parts of my practice, and some people come for both, but some people come for just chiropractic care, and some people come just for functional medicine. So, and sometimes there's overlap. Like, if someone is coming for functional medicine because they have Lyme's and they're exhausted, or they have diabetes and they don't want it anymore. They want to be better. They want their markers normalized naturally. And in the process, they learn about chiropractic and they, say they want to be adjusted. They can, of course, but so when someone is coming in for chiropractic care, I initially assess them, and based on their history, the goal was always to help them get to maintenance where they're not coming in as frequently. But in the beginning, they might be coming in once a week, for 6 weeks, until they're really progressed and their spine is a lot better and their posture is better and they're functioning and they're doing great. Then we might see them once a month or once every 3 months if it's a much younger person. And for functional medicine in the beginning, might see them once a month. After the initial, I usually see them in 2 weeks when we get labs back and so forth. And then depending on how much support they need, I might see them again in another 3 weeks, and then maybe not for 6 weeks. And then it's much less frequent. Once they're really, very much comfortable with their lifestyle and they're getting the results and they feel strongly independent, which is my goal.
Yeah.
Then they might just come in like a couple times a year.
Okay. All right. I see a chiropractor now. I have one of those necks that just, I'm doing my cell phone thing all the time, so I know you see a lot of people with that. And so I'm doing my work, and but it's the thing about it. It's so insidious because it's something that's been going on for a long time, and I don't have a clue. So I just happened to go for a checkup, and they did an X-ray, and they go, okay. Well, and I'm like, yeah, I do want to take care of that. I don't want to be, one of those people you see hunched over, because that does happen. And then once that happens, again.
Yeah, that's heartbreaking because that's preventable.
Yeah.
So it's so smart. You're taking care of your spine and preventing those discs from degenerating, because once that happens, we really can't restore much there.
My father, he suffered a long time. I think from the time he suffered at least like 20 something years. He died when he was 88. And I remember when he was in his late 50s, he started to fall down a lot. He had ankylosing spondylosis.
Yeah.
So he was paralyzed from but he was never in any pain. So he was still daddy. He was still.
Thank God for that.
He was still the one that was, he just, we fed him, we helped him as much as we could, but we never really understood how traumatic it was to him, because he was a very strong man prior to that. So, when he passed away, but at the time that he, because he still was dad, he had kids, he had grandkids, he had great grandkids, but he was still the patriarch,
Patriarch.
Yes.
Yeah, with dignity.
Always. But, once he was gone, it was just like, oh my God, he really suffered. We just couldn't see it. And so this is the kind of thing that I think that, I don't think anybody really understands when you're going through it, when you're going through things, when a family is going through things. So this is why I'd like to reach out to people and to kind of shake them up a little bit so that they can maybe make it easier for somebody in some kind of way, because we used to joke around and say things that probably were very hurtful to him, but you just, especially kids, you don't think about your parents as having feelings, never. Terrible. But, it just, so I just like to sometimes work with my clients a little bit and kind of even whisper in their family members' ears too a little bit that, you might need to do something a little bit different as well.
Yeah.
Right.
I think the family, there's a quote about what lifestyle medicine is, and it involves the family. It's basically helping people and their families adopt healthy behaviors and healthy nutrition and basically a healthy lifestyle.
Right.
So it does need to have that support of a family.
Support of the family.
Or social. Some social support makes things twice as effective for even weight management. That's a known thing.
Weight management. Yes.
Any results. So when you don't want to go through any of this alone, it's not necessary.
Right. And it's not impossible for skinny people to be, not just because you're skinny doesn't mean you're healthy, doesn't mean you're sick.
Oh, you're going to love this quote. Listen to this. Fitness is better than ideal weight. One study showed that obese people who are moderately fit have a lower mortality risk than people of normal weight who are unfit. This is from the European Endocrinology. So fitness is a better health indicator than weight. So on the flip side, I do see people coming into my office with pre-diabetes markers, meaning that's why they're coming. Their blood sugar now is in this pre-diabetes zone. They look so fit. I mean, they look thin is what I should say.
Right.
They don't look overweight and their BMI is normal. However,
what about their waist?
That's it. The waist circumference. You just hit the nail on the head, Carolyn. So their waist circumference is enlarged and they have a sedentary lifestyle. Some of these people don't have a sedentary lifestyle even. So it's their diet and their waist circumference, like too much beer, whatever the case may be. We find what it is. We remove what's hurting them and we add in what they need to correct.
All right. So you work a lot with the microbiome then too, because that's one of the things that'll make that waistline. I mean, even even if it's not a lot of fat, it's something else that your colon is
bloating.
Right?
Yeah, there's some kind of bloating. And another thing that you mentioned, the microbiome, sometimes people are craving sugar like crazy and they don't, it's actually not just them. They have a yeast overgrowth in their microbiome, and those yeasts need the sugar to live. And so we do a lot of cleansing, a lot of detoxification. I do a lot of markers for oxidative stress with people with prediabetes and diabetes, because and inflammation markers, because sometimes it's not just the blood sugar, but the tissues are getting damaged from oxidative stress. So inflammation is like fire and oxidative stress is like smoke. They're both damaging. So everybody learns where they are with their markers and how to reduce inflammation, how to reduce oxidative stress.
Okay. Listen, I know you're Jack Russell. You want to take care of him? We can wait for you if you want to take care of him.
Okay, thanks.
Yeah, give me a second.